Good day, everyone. This is Cynthia Gartman with Seniors BlueBook. I am being joined today with Mary Brunsky of Demeter Financial Services. Hi, Mary. How are you?
Hey, good. How about you?
I'm doing good, thank you. So you're going to go ahead and tell us a little bit about you and your firm, and then we're going to get to talk about Medigap and Medicare supplement plans and Medicare Advantage plans, and let's run screaming from the room is how I feel about it. So
You're not alone in that. Oh, so thanks, Cynthia. I started doing financial services about 8-9 years ago in Central PA, and it's a second career for me. And I started thinking about some of this, or included the Medicare, when my mom moved in with us. She was in the early part of a stroke-related dementia, and she had been a single mom, struggled financially most of her life. So our financial advisor at the time said I should consider looking at doing this, and because of the things we ended up going through with mom and trying to find information, I knew I could offer something to people. So that's why I added the Medicare planning to my services. Healthcare costs are a major source of money concerns in retirement.
Absolutely, absolutely. I've heard that couples should have between $270,000 or more set aside for healthcare costs in retirement. How can someone who set aside $50,000, $100,000 even begin to address that?
It's not like you spend all that in 1 year. When you look at the total of what is spent each year, though, you can hit that number over a 30-year retirement, and more people are facing those kind of numbers. So that's why selecting the Medicare plan can be so crucial.
Okay.
One couple I just talked to recently, they wanted to go to a Medicare Advantage plan because so many of those, they're $0 premiums that you don't pay anything each month, but you do pay co-pays and co-insurance, and they thought this was a great thing.
Okay.
So one of the things I was able to show them was that with the prescription drug coverage that came with that, it didn't cover one of his medications, and it would end up costing them around $7,000 a year in drug costs and co-pays at the doctor.
Oh,
By
wow.
paying for a supplement plan with a Part D prescription drug plan, it would end up saving them about $2,000 a year.
Okay. Okay. That's quite the savings, isn't it? I certainly know I would love to save $2,000 a year. So can you tell us what the difference is between a Medicare supplement and a Medicare Advantage plan is?
Sure. So let's first discuss the Medicare supplements, and it's also called a Medigap plan. Those are interchangeable. And those are the plans that most people are familiar with. They've been around forever. And they are with private insurers that cover that 20% that Medicare doesn't pay. So currently, if you get like a Plan G, it covers everything that Medicare covers, along with the Part A, that's the hospital cost deductible, but not the Part B annual deductible. That's about $198 for 2020. Now, there are other letter plans, and they can cover a chunk of the costs, or may only cover maybe 50%, and they typically have a lower monthly premium. And then here's the other kicker with all these things, is each insurance company has its own rate. For the same Plan G, you might pay as little as $132 in Central PA, or I've seen some here recently for $113 a month, or it can go over $200 a month. And it's the same coverage, just different. So some plans offer household discounts, some don't. And you have to have a Part D prescription drug plan coverage with that. So if you aren't on any medication or any, you can look at low cost plans.
So if you're not on any medications, like my husband's not on any medications, drives me crazy. Why would you want to sign up for a Part D prescription plan? Isn't it a waste of money if you're not ever taking any, or just, once a year taking an antibiotic? Isn't it a waste?
Well, you would think that, and unfortunately, though, it's best if you go ahead, because there's a penalty if you don't. And that doesn't sound like much. It's a 1% of the national average for a plan, which is $34.74 for 2020. Well, so
Okay.
that works out to about 33 cents, but it's times the number of months you don't have coverage.
Okay.
So I have one client who's paying $33 extra a month because she didn't sign up in 2006 when the program first started. And that
Okay.
penalty is for the rest of her life. They tried to charge her husband as well, but we were able to show he had veterans benefits, which counts as far as Medicare is concerned as credible coverage. So they waived the penalty for him.
My goodness. So 33 a month for the rest of her life for every single month that she's going to get penalized. Oh my gracious.
Right.
Well, people definitely want to try to figure out how to avoid that because that's just like burning money.
And like you might as well flush it.
Yes, yes, yes. You might as well flush it down. That's right. So what else do we need to know about supplement plans? Because I think there's even a little distinction there, isn't there?
Right. Well, the biggest benefit, in my opinion, to the supplement plans is that you know in general how much your healthcare costs are going to be for the year. And these
Yes.
plans are accepted by any doctor or facility that takes Medicare. So if you travel a lot, this can bring you some peace of mind.
Okay. And so how is that even different with Medicare Advantage plans? Again, a lot of acronyms, a lot of words that seem to be very different.
Right. So with the Medicare Advantage plans, you're dealing directly with the insurance company.
Okay.
And yet you still need to pay those Part B premiums to the government.
Okay.
But those plans essentially replace Medicare. The benefit they offer is they have a lower monthly cost. Some are even as low as $0 a month. And how do they do that? Well, they do that by requiring copays and coinsurances and still have some deductibles. So it's
Okay.
kind of like your employer plan. The cost is in using it. So
Okay.
also, you have a network of doctors or facilities that accept the plan. There's a cap of how much you can pay out in a year. So maybe anywhere from $4,500 in network to $10,000 out of network. And that's on an annual basis. So while you may not know how much you'll spend each year, these plans do offer things the supplement plans don't. There's some hearing, vision, dental benefits. There might be transportation trips, and some even offer meals at hospital stays.
Oh,
The
wow.
big downside is if you travel frequently outside of the service area, while you can get emergency care, if you require long-term rehabilitation services, you're going to have to
Hmm.
come back home to get the in-network care. And
Oh,
there are a
okay.
few companies now that are setting up some nationwide networks, so you just have to pay attention to what you're getting.
Wow. Okay. So that's a lot of information. Is there anything else we need to know about when we're looking at Medigap, Medicare, Medicare supplement plans, Medicare Advantage plans? I think I caught all the words there, hopefully.
I think you did. One of the things that most people don't know for sure is you can switch a plan if it's not working for you. Now, with the supplement, you can switch any time of the year.
Okay.
The catch is you will have to medically qualify for the new plan if you're not doing it in the first year you're eligible.
Okay.
So if you've had a major health issue, particularly a chronic condition or one that's ongoing, the new plan can decline to cover you. It really depends on what you're dealing with, and because some things they'll accept and others are an automatic decline.
Okay.
For the prescription drug plan, you can only
Hmm.
change that once a year from October 15th through December 7th. And when you see
Okay.
the nonstop advertising on TV, that means it's open enrollment time and it's time to review what you have.
Sure.
Um, like the Part D prescription drug plans, open enrollment is when you can change the Medicare Advantage plans as well. So
Okay.
if plan isn't quite like what you expected over the year, you can see what
Hmm.
other plans in your area are offering and change. During
Okay.
that time, any pre-existing conditions, just for the Medicare Advantage plans, they don't matter.
Mm.
What you will need to pay attention to is whether the new plan works with your doctor or the facility if you want to stay with them.
Okay. Okay. That makes a lot of sense. How do you help people with this? What is your process?
Well, I'm an independent insurance broker and licensed sales agent. So I
Okay.
help people who are already in the Medicare plans review whether they should consider something different. I
Okay.
highly recommend reviewing Part D prescription drug plans every year as their costs can change. For people who are new to Medicare, I help them understand those different parts and help them determine which plan will best help them sleep well at night, not worrying about their health care.
Okay.
If they're comfortable with sharing their medications, I verify that all the drugs are covered in the plan and what the costs will be. So
Oh,
if they
that's
like,
nice.
we can look at the finances then too to look for a funding stream to pay for these things.
Cool.
So I think you're posting afterwards the information on how to get in touch with me. We can
Yes, ma'am.
spend about 10 minutes, talking. Let me know what your concerns are. And then from there, we would determine or probably set up a meeting, and we can do that over the phone. There's a lot of plans now that you can enroll in online.
Okay.
Or I can even meet somebody at the end of their driveway, whatever their preference is.
Well, excellent. Thank you so much, Mary, for joining us for Seniors Blue Book's Senior Care Spotlight. We enjoyed learning all about Medicare Advantage, supplement plans, Medigap, all of those wonderful things, and know that you're a great resource for folks. At the end of this, you're going to see Mary's contact information, her website, her email address, and her phone number. So just reach out if you need any help and let us know. I hope you have a great day. Bye, Mary.
Great. Thank you.